Hi, my name is Adam Rindfleisch. I'm one of the physicians with the University of Wisconsin Department of Family Medicine. I work with the Integrative Medicine group here, and it's my pleasure to talk to you today about breaking news in bone health, particularly osteoporosis and osteopenia, and ways that you can prevent fractures. Now, oftentimes people will work with medications, but one of my main focuses today is going to be on non-drug approaches that can complement the use of medications for osteoporosis. We'll talk a little bit about risk factors and diagnosis, and then we'll move into diet and supplements, and then some overall ways with lifestyle to decrease risks of problems. Now, why do we care about this? There are a few reasons. Every year in the United States, there are 1.5 million fractures. Of the people who have those fractures, 5 to 20% are going to die within that first year because of complications related to the fractures or illnesses that they contract as a result of being injured. In addition, about 60% of people who have the fractures are going to be permanently disabled in a way that will require them to have additional assistance over time. So we've got to do what we can to prevent those fractures and to keep people as healthy as possible. So there are three main points I would like you to take home with you when it comes to thinking about bone health. The first is that the bone is a complex system. It's alive, it's in motion. The osteoblasts are building bone, the osteoclasts are tearing it down. And what we're trying to do with anything that we do with bone health is to balance that out in a way that maintains the bone's integrity. Issue number two, remember that this is really about prevention. Most people build bone density by age of 30 to its maximum, and then after that there's a steady decrease over time. So you want to start working on bone health as soon as possible. That even means during the childhood and teen years. Remember that bone density is an issue for men as well as women, though it's much more common in women. And keep in mind too that genes only play a partial role. Only about 50% of fractures are thought to be from irreversible causes, and the other half are reversible causes and things that we can actually do something about. Third point is, remember that there's much more to it than just bone density. That's something that we can measure, and it's important, but it's not just about bone quantity, it's about bone quality. And so what we're trying to do as well is make certain that we have good quality bone, and that includes doing things like shaping the bone through exercise and making sure that the bone isn't injured in any sort of a way. Falls being the main way, and doing everything you can to prevent falls, keeping the carpets from tripping people up, making sure that stairs are safe. I have a number of patients who've tripped over the house cat and been hurt. Working with that kind of thing is very important. As far as screening for osteoporosis, you've probably heard of some different screening tests out there. The main test and the test that's recommended in mainstream medicine is the DEXA scan. It stands for Dual Energy X-ray Absorptiometry, DEXA. There are two different X-rays strengths that are run through the bones of the vertebrae or the bones of the femur, and then those two strengths are compared in terms of how far they go through the bone to give you a bone density measure. When you're doing DEXA scans, it's probably useful to use the same scanner over and over for a person, so that is better not to change locations if you can avoid it when you get your bones scanned. When you get the results back, it comes back in terms of two different scores. The T-score, which is a measure of how you compare with 30-year-olds of your gender, or the Z-score, which is how you compare with people who are age matched to you. Usually we determine whether or not someone has osteoporosis or osteopenia based on their T-scores. It's basically just a statistical number. If you're in the lowest 2.5% of the population, you're diagnosed with osteoporosis. And if you're in the 15% above that, you're given the diagnosis of osteopenia, which is sort of a pre-osteoporosis sort of a number. Medicare covers bone density screenings once you qualify for Medicare, and a lot of organizations recommend that women should be scanned, particularly if they have risk at age 65, men at 70. You'll see other recommendations out there as well. It's interesting that they also recommend that if you're at high risk for fractures, or if you've had fractures before, a big family history, if you meet different criteria, which I'll mention in a moment, then it's probably worth it to have the bone scan even earlier. You should space the bone scans out every year or so, because if you get them done less than that, then you may not be able to see a measurable difference in bone density. As far as urine testing and CT testing and ultrasound testing, there's really not data that this is as useful as the DEXA scan, and so at this point I'm still recommending that people follow through with that. Now, as far as risk factors for osteoporosis and low bone density and poor bone health, the typical risk factors that you'll see most commonly mentioned are older folks, of course. People who are over 65 are much higher risk. People who are from an Asian or Caucasian background are at higher risk, but any group can be subject to osteoporosis. osteoporosis and osteopenia. Less than 125 pounds increases your risk, as does alcohol intake and tobacco use. There's a dose-related response with tobacco use. The more you smoke, the less dense your bones are going to be. In addition, less estrogen during your lifetime. If you have menopause earlier or your periods are infrequent, that kind of thing can affect your bone density, and not getting very much exercise can as well. People who have history of fractures or people who have certain medical conditions or take certain medications are also at risk. Now, for a full list of all of those, I would say take a look at our website because that goes into it in detail. Diet and bone health. Now, of course, this is one of the areas you hear about all the time in terms of maintaining bone density. There are many vitamins that are involved and many minerals, and I'll talk about those in a moment. But some things to keep in mind in terms of foods that are thought to be helpful. When you're thinking about osteoporosis or bone density and foods, some of the bone builder types of foods include broccoli, lettuce, mushrooms, French beans, a lot of fruits, including citrus of any kind, pomegranates, and in addition to that, certain herbs and spices can also be helpful. Turmeric, dill, and fennel is also something to think about. Soy protein is probably a good additive for the diet as well. Certain people find that soy protein probably works better in the diet for them than in supplement form, and that certainly bears out in the research as well. Allium plants are another good food. That means onions, leeks, garlic, and cucumbers are another one that you'll see listed. It's important as you're thinking about diet and osteoporosis to think about a few numbers. Less than 4 cups of coffee a day. Tea's probably not as likely to decrease bone density, so not as much of an issue. Less than 5 carbonated beverages a week. That's because the different acids in soda may actually decrease bone density in various ways. And then keep alcoholic beverages under 7 a week as well. Some people will talk about omega-3s as having benefit for bone density, and you'll also see mention of alkaline diets. Unfortunately, alkaline diets and certain ways of eating to maintain a certain pH in the body are still fairly controversial, and the research isn't there. The nice thing about those diets, though, is that they really do tend to include a lot of foods that are very healthy and rich in calcium, magnesium, and so on. So definitely worth working with, regardless of what your stance is in terms of the research. As far as supplements for osteoporosis and bone health then, of course the one that you hear the most about is calcium. Now with calcium, a few things to keep in mind. One is that dairy intake, when you're not taking vitamin D as well, really doesn't decrease your risk of osteoporosis. The other thing to keep in mind, and that I see as a pitfall for a lot of patients and practitioners alike, is when you think about the recommendations for calcium, you need to think about it in terms of elemental calcium content. That is, every salt has a different amount of calcium. Calcium carbonate has one amount, calcium citrate another amount. And what you're really looking for is just the calcium, not the citrate part. So keeping that in mind when you're looking at recommendations is important. Now, in terms of the recommendations, you'll see different things come up. 1,200 milligrams of calcium a day is recommended for people over age 50. From age 19 to 50, it's 1,000. And then you'll see various recommendations that are a little bit higher than that for young women and girls up to age 18 or 19. With the calcium side of things, I remember that it's probably best to take calcium in multiple doses per day as opposed to all at once, and that certain supplements probably work better for different people. Calcium carbonate is probably not absorbed as well by older folks, and calcium citrate is probably absorbed better by people who have less acid in the stomach. For example, people who are taking proton pump inhibitor medications. Another important supplement that you'll hear about all the time is vitamin D. Vitamin D takes 2 forms. Cholecalciferol is vitamin D3. Ergocalciferol is vitamin D2. D3 is absorbed a bit better than D2, about 3 times as well, but both of them are found to improve bone density and bone health. Vitamin D is involved in hundreds of reactions in the body and also seems to be helpful with some mood-related issues with bone and muscle aches and so on as well. I'm a big fan of checking levels, especially in places like here in Wisconsin where people don't have as much light exposure. What they found is that if you go out into the sun, if you're a fair-skinned person, and spend 20 minutes in the sun with your face and arms exposed, you'll get about 20,000 IUs of vitamin D in your skin, but it's almost impossible to overdose. As far as dosing when you take it orally, they recommend that you take it with food, and that The recommendations vary greatly from one source to another, but at least 600 to 800 IUs daily is a good place to start. Some integrative medicine providers, and I'm included among these, I recommend going for 2,000 a day, especially in people who don't get out into the sunshine much. The Institute of Medicine calls the upper limit 4,000, but most of the data indicates it's quite hard to overdose on vitamin D for various reasons, and that probably the idea of vitamin D toxicity, while out there, isn't necessarily as much of a worry as was initially thought. Not a bad idea to get a level tested, and then that can guide you along the way in terms of your function with and how much you should take. Vitamin D should be measured as 25 hydroxy vitamin D, not 125 hydroxy vitamin D, which is a different test and relates more to renal function. Vitamin K is another supplement you'll hear a lot about, and for good reason. It synergizes with vitamin D. It's something that many Americans and many people worldwide are deficient in. And because it really does seem to decrease the risk of fractures. There was one study that indicated an 80% decrease in risk when you start taking vitamin K when you need it. Vitamin K1 comes from leafy greens, and vitamin K2 comes from animal products like meats and cheeses. I highly recommend that patients consider that, and dosing ranges from 10 to 25 milligrams typically for K1 and K2 respectively. As far as other supplements, magnesium is one that you'll see mentioned. Magnesium is something that's deficient in 80% of the United States population. The other one that's gotten a lot of attention lately is strontium. Now, strontium is a little bit of a challenge. Most of the studies that have shown benefit are the salt strontium rhamnolate, which is also known as protilose. It's available by prescription in 70 countries, but not in the United States. So what happens in the United States is a lot of the supplements that contain strontium have strontium citrate, which hasn't been researched as much. Probably doesn't hurt, but it's just not clear how much it helps. So keep that in mind. Other minerals such as boron, zinc, copper, and so on are showing some promise, but we just don't have as much data about them. What I recommend to folks is just take a really good vitamin and mineral supplement, and you're usually covered. One thing that I talk about with folks is herbals. There are a lot of herbal supplements that are out there for bone health. Not a lot of research, unfortunately, that we can base recommendations on, although one supplement, which is ipriflavone, I-P-R-I flavone, is used commonly and does show some real promise. Ipriflavone is a relative of one of the soy isoflavones, one of the phytoestrogens out of soy. Ipriflavone is taken 200 milligrams 3 times a day, and it works really well for bone-related pain tied into osteoporosis, which is great. We don't have as many things for that as we'd like. The problem is that it decreases the leukocyte count in the bloodstream too. So oftentimes you'll find that it really should be followed through a physician if you're taking ipriflavone to make sure that those lymphocytes stay good. Typically they drop and then they come back up and recover well, and it doesn't lead to any problems for people, but something to keep in mind. As far as other approaches, the other one I haven't mentioned so far is exercise. Exercise is incredibly important. Our bones grow based on the forces that they're exposed to, and the more we can do weight-bearing exercises or exercises that put stress on the body, the better off we're going to be. Now, many people walk. A lot of the recommendations will say that it's better to walk about 3.8 miles an hour or more if you want to get enough movement for the bones or enough weight-bearing for the bones to really get the density maintained. Weightlifting, resistance training also seem to help, but you really do need to push it a little bit. There should be a little bit of force involved with the exercise to help the bones out. Last but not least, I do tell people, even though the data is still limited, to pay attention to mood, because low mood, stress seem to affect the function of the different bone cells. And so it's important to keep that in mind and to do everything you can to, and this is true for many conditions, to keep your stress under control so that you can decrease your risk of illness. And that covers it. Those are some of the highlights. I would encourage you to read more on our handouts on the website. If you Google DFM Integrative, you'll find all sorts of handouts on integrative medicine related topics. Wish you well. Hope your bones stay healthy, and thank you very much.